Get started now. Just a reminder, 30 minutes, one question, one follow-up. We have Dr. Williams and Dr. Yaffe here today, so I'll turn it over to them for some brief remarks.
Yes, good afternoon, and it's Thursday, so we're looking at what's happened this past week. It's been a week since we had some of the modeling update from Dr. Brown. He's not here today, and so, but we've had some further updates and keep that data clear. And so we're seeing how we're trending, and there are some concerning issues that we are dealing with right now. We were precarious last week. We are now trending in the wrong direction at the moment, heading up with a higher percentage. So before we make some comments about that, I'm going to ask Dr. Yaffe to go over the numbers because they need to be raised for attention. So Dr. Yaffe, over to you for the data for today.
Thank you very much. So today in Ontario, we've reported a total of 2,432 cases of COVID-19. And when you break it down, about 57% of the cases are in Toronto, Peel, and York regions. Since Monday, Ontario has performed almost 147,000 tests with an average positivity rate of 4.8%. In today's report, the positivity rate is reduced a bit down to 4%, and that's a reflection of 58.1 thousand tests. We do have a number that are persons under investigation as well. As our cases have increased in recent weeks, so too have our hospitalizations and, unfortunately, the deaths. Today, there are 919 people hospitalized with COVID-19 in Ontario, and of these, 263 are in the intensive care unit. And tragically, since Monday, we're reporting another 86 Ontarians have lost their lives to COVID-19. As of today, in the last 24 hours, 23 deaths. We do not want to forget that all of these numbers represent human beings who have people who love and care for them. And we want to offer our sincere condolences to those impacted by the lives lost and offer our support to those recovering from the illness and those caring for them. I'll turn it back over to Dr. Williams now.
Okay, well, as I said, the numbers are concerning. Last week at this time, we were having this hovering around the upper 1800s to mid 1900s. This past weekend, we've moved past the 2,000 mark. We've had some record numbers of 2,400 in a day. Added to that, we've had record amount of testing being undertaken in that, even over the weekend. And it looks like we're going to continue on that trend where we may be well above 60,000, heading closer to 70,000 tests in a day. And as we are starting to do some other testing, use of our methods of our rapid access testing, those numbers will grow again further, which is good. We're doing more and more testing in more and more areas to find any cases and as many as we can identify. So last week when we had Dr. Brown here, we talked about are we at the 1% leveling off level? 1 to 1.1% growth of that, or 2 or 3, and where were we trending? And there was the concern is that we're sitting there, are we going to start coming down, or are we going to continue to progress? And if we're going to progress, are we going to progress rapidly? You can see with the numbers where we're up to 21, 22, and now 2,300 cases in a day. That's moved us beyond the 1%. We're in somewhere in the 1% to 2% growth in that. And is that a continuing trend, or is it one that can be abated? So when we start to see those cases, and as you said, Dr. Brown has alluded to, when you see that, while it starts off slow, it can pick up fairly rapidly, and so we have to take this very seriously and deal with the concerns and matters in that respect. And you've heard comments from our health officials. Those in the hospitals are seeing more and more cases, because the more cases you have, the more there's a percentage of those that will end up going to the emergency department, a percentage of those will be hospitalized, a percentage of those will be put in the ICU, and some will be ventilated, and unfortunately, a percentage of those that will die. We've made good progress at changing some of those critical care methodologies, and our specialists have done excellent work at reducing the median time stay in the ICU. Nevertheless, it's like a flow coming in and a flow going out, and as you start to use up more and more of those ICU beds, less of other ones can get into those beds, and that means you have to start to curtail in some of the centers, the hot spots, so-called gray lockdown zones, the red zones. They are facing that challenge right now, and then they have to then defer elective surgery, because there's still other cases coming in that are not elective, but they're emergency cases that have to be dealt with as people are out and around and still involved in things like motor vehicle accidents and other aspects that put demand on the system. So we're listening very attentively to that. We've had some information out from our CEO, Mr. Anderson, on some of the things and asking hospitals to curtail some activities there. And we've had commentary from various people asking for more stringent action to try and see if we can bend and bring this down. We're not the only jurisdiction. We've seen that from other provinces and territories. And while some are, like we were a week ago, are saying maybe we're plateauing, maybe we're coming down, the virus has shown itself to be very resilient moving through the population, especially with the public, some not adhering to the standards and choosing various reasons to set that aside and put themselves and their family members, and of course transmission to vulnerable people, at risk because of the need at the moment. And so we have a real challenge that how are we going to work at those who are unwilling to come back to being willing and encouraged to maintain vigilance in the aspect there, and then those that are unable, how do we enable them and help them to do so? And we're looking at some strategies, especially those that are from areas where because of income issues and lack of support, how do we help them and their family members to isolate properly and to stop and halt the spread within their family, household, and in their neighborhood and community. So we have many things on the go. We have our health units doing lots of case contact management. And it's interesting that as of a month ago, while our provincial number was around about 68% cases per 100,000, a month later now we're at 87.9 per 100,000 for the province writ large. And whereas a month ago 75 to 80% of our cases were in Toronto, Peel, and York, this latest set of data, those numbers, even with the 2,300, that's dropped down to 60, 56 to 60%, and so more have moved out into the outer areas, and we have more health units in the outer areas that are having over 100 cases a day. So we see this rippling out into the province in wider and wider areas, that it's impacting and having more and more outbreaks, especially in workplaces. In there, our schools, for the most part, while there are some that have been closing due to administration issues, we've had the Section 22 in Windsor, where they've had some issues more there they want to deal with, and because Windsor is now in the lockdown zone there. And so, but for the most part, the schools have remained open and have remained a safe place for the children to attend. But of course, by this Friday, they're going to be staying home for the holiday break. And so we're going to watch that very carefully. We have our usual pattern of looking at which health units that would be changing in the framework, and that will be going for decision making tomorrow, as is our usual schedule. And I've also been asked to make recommendations what we might do further to deal with the matter, and I made those recommendations, and we'll wait to see, because everything's on the table that needs to be considered, and waiting to determine fairly shortly what steps and measures we may have to take to see how we can come back off this 1 or 2 to 3% growth and bring that back down in that. It is interesting that in our areas of Toronto and Peel that have been in the lockdown for now going over 3 weeks, we have seen their, from about 3 weeks ago, their number of cases per 100,000 level off, their percent positivity coming down, and their R effective, that term, has dropped down, so they're below 1. So we can see there is some effect of that lockdown procedure, but talking to the MOHs there, they would have liked to have even come down more assertively so they can come out of the gray zone into the red or orange zone, if you may. So we know the benefits of doing that. How do we do it? How do we enable that and ensure we're going to take steps? Because we have it here, not just our schools and long-term care, but at risk, of course, is our healthcare system, and we don't want to see that compromised because it backs up. More and more elective cases get canceled, more and more semi-elective, and urgent ones are at risk, and we're worried about the morbidity related to those deferrals as well. So we all have to pull together to maintain the bend in the curve, to bring it down. And even with the festive season, a different Christmas, a COVID Christmas, a Christmas Hanukkah, and Christmas seasonal break for people to do it more carefully, more cautious, only household, and to do all those things stringently, assertively, so that we can enter the new year in a better state than we are now. So much to consider, many detailed information, not what we would like to be talking about at this time of the year, but we need to have that personally, a serious discussion, family-wise, our households, and how we're going to do this, because we want to protect ourselves, we want to protect our family members, our vulnerable members, we want to protect our community, we want to protect our schools and long-term care system, we want to protect our hospitals. And so we have it there for us. So we all have to pull together, and we're going to do our part, and my recommendation is to see what we can do to enable that to happen in the days ahead. So those are my comments there at this time, and I'm going to hand things over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question from Nick Dixon, CP24.
Hi, doctors. Thanks for taking my question. You've talked today about the challenges and concerns and the sort of negative trends that are happening. And both you, Dr. Williams, and the Premier are saying that everything's on the table. So I suppose the question is, does the GTHA need to be shut down, including schools, for maybe between 2 to 4 weeks? That's been suggested by the RNAO, OHA, various infectious diseases experts, even some elected officials. Do we need to expand the scope of the lockdown framework? Would you make either or both of those recommendations to the Premier?
Well, as I said, and we've had discussions with doctors Lowe and Davila. We've already had some before saying, well, we have the gray restrictions, and they've taken some steps in there with their own powers and authority to enhance that, if you may say, a darker shade of gray, perhaps, asking what more needs to be done to not only just hold the line, but to bring it down. And so I think with everything on the table, that was already being proffered before by the two that have been locked down the longest, York Region joining them and Windsor. And as I said before, beyond the GTHA, we have a number of health units outside that. Their numbers are going up fairly rapidly as well. So the issue is not just within a few. We have some wider issues. So it's not just what we need to do in the GTHA, but what do we have to do in the wider area as well. So all things, as the Premier said, are on the table, because we do have to be take a sober reflection and decide what we need to do to turn this around.
Follow-up?
Okay, and I know, and perhaps you're alluding to this, but perhaps Hamilton may be a concern based on their recent case numbers, but if you take a look at the Halton numbers, maybe that's not so much on your radar. But so the question is, could you see a lockdown that would leave Halton in the red, but leave the rest of the Western GTHA perhaps in a lockdown, or as you say, a darker shade of gray? Does it need to be a consistent lockdown right across the board regionally in order for it to be consistent and effective?
I think the questions you're raising are excellent. They're all the ones that are on the table. As we look at that and say, in parts and bits and pieces and wider an issue, this is all in the discussion. And so I think the points you raise, we're having vibrant discussions. We've been discussing with the MOHs in those respective jurisdictions. All our red restricted zones, their numbers have been escalating. Their percent positivity has been going up, and their cases per 100,000 have been going up. I said the only ones that seem to have leveled a little bit at the moment is Peel and Toronto at this time. And so it shows that there is some benefit from a lockdown, but maybe we have to look at what else we can do, and then who else should be involved in that. As I said, all things are on the table.
Next question.
From Lucas Meyer, Newstalk 1010.
Thank you very much. Dr. Williams, on schools specifically, obviously you've heard the calls for, various calls for the extension of the winter break, and, the warning to parents, well, we might have to go to virtual, those first 2 weeks of January. The TDSB has said that would totally be up to the government, the provincial government, and either Toronto Public Health. If you were going to make a decision on that, when would you want to make it by so that parents have an idea of if they're going to have to get ready for, the first weeks of January with their kids at home? When do you want to be able to make that decision?
I think the key decision is when is the Ministry of Education going to make that on my recommendation, and they made it clear they need a certain time of lead time in order to do it. So it's a big entity. You're dealing with over 2 million students and staff and institutions and settings. So it's not a small entity, and it's like a big, large ship. It takes a while to change course and to slow it down. So I would have to be consulting with the Ministry of Education and seeing what kind of lead time they would need to do anything in there. And of course, we're all wondering how will the numbers do in the next few days or so, and as we go into the holiday season, will people use constraint and proper adherence to public health measures or not, and will our numbers plateau and even hopefully come down in there. But we have to have a certain lead time, because they can't just start things and stop and change things on a whim. It needs a lead time, and that's really in consultation with the Ministry of Education.
Follow up?
Do you have do you have your own idea of what that would be, or are you looking at least a week before to give them that sort of lead time?
My understanding from the Ministry of Education, they need more than a week ahead. They need more than that.
Next question is from Randy Rath, CHDH-TV.
Yeah, hi, Dr. Williams. I have a very simple question. You say that you have made recommendations to the government as to what we should do to get these numbers down. Could you tell us what those recommendations are?
No, I can't right at this time. I think I've given you some ideas of some things there. We're trying to give all the information that they need to have to make decisions. And as the Premier said, all things are on the table, and the Minister of Health has said the same thing. And so my recommendations matched with the data and information and the updated modeling data, including the healthcare system metrics, are all things that go on to make a decision. And so I'm waiting to hear what that will be. And so we've been as clear as we can on that, and I made my recommendations as clear as I can.
Follow up?
Okay, the Hamilton Public Health has stopped telling the public the ages, sexes of people that have died from COVID, and they're also refusing to say if people that have passed away lived in congregate settings. So we have no way of knowing if there is something wrong in a long-term care facility. Is that an appropriate thing for Hamilton Public Health to keep these statistics secret?
I had not heard the details of that at this time. I know probably Dr. Yaffe has a comment to make dealing with surveillance data, reporting, and maintaining privacy and protection of people's personal health information in certain jurisdictions. So I'll hand that over to Dr. Yaffe to add some comments to that. And as I said, I haven't heard the details specifically what Hamilton's doing in that regard.
I must admit I hadn't heard that either, but I don't think it's unusual to have a health unit say that they prefer not to give the details on people who have passed away because it could divulge some private or confidential information in terms of who they are. We do have generally information about the number of deaths in the province and information as to how many of those were in long-term care facilities, for example, and their general age range. So that information is available at a provincial level.
Next question.
From Antonella Artuso, Toronto Sun.
Hello, doctors. I was wondering, are you considering any stricter measures for individual behavior? There has been discussion around curfews, stay-at-home orders. Certainly a lot of the enforcement has surrounded businesses and organizations. And are you looking now at individual behavior?
So, one of the challenges you're asking there is we've identified all our medical officers have seen, even some in the lighter colored zones, yellow and green, that people's personal behavior has become more and more people being more lax at it. There's still most of the people are doing a good job at it. But you don't need a large number to do that, as we've seen our super spreaders and they move through. So the question is, how do you change people's personal behavior to bring it into line with that? And we've looked at the concepts, and everybody likes to tout the example of the Melbourne and their very extensive and prolonged lockdown. Did it work? Did it not work? We've looked at different issues, and certain countries have different ways they run and operate than Canada. And so we have to, all the different data and information is put on the table to look at. But the real challenge is that, how do we do that? We noticed our mobility data when we were comparing ourselves to our first wave, and I know Dr. Brown alluded to this last week. We were much better at people staying at home and not going out and around in our first wave. We were leading the country in that, for example, without curfews and limitations and that. And now we're only about, I would say, about a third where we were. And so can we get that back down again, especially for a concerted effort? Because people said, well, it seems just going to go on forever, but now vaccines have started. We've done our first 1,000 people. We're moving that forward. It's starting to take off, and there's a light at the end of that tunnel. So instead of saying, well, I'm just going to, like in a long run, just give up, no, we can get back down, focus, and go to the end there, because we see there's an end in sight to it, and there's a benefit to gain because our healthcare system is at risk of being overrun with a load of that, and we want to keep our cases moving as best as possible. So I think we were successful before at getting our public in line with that, and people saying, okay, I see it, and I can invest in that, and it's just for a number of weeks. We can do this and hold tight. I think that's what we want to do in that, and can we recreate that type of commitment back again to most of our public in that.
Follow-up?
Okay, this is a follow-up to a question that you were asked last week about whether, I think you mentioned that residents of nursing homes, even if they had experienced COVID-19, would still be offered the vaccine. Is that true of the general population as well? If you've had COVID-19, you're not in one of the high-risk groups, would you still be expected to get the vaccine? And would you have any way of knowing whether you'd had COVID-19 before you get the vaccine?
So I know Dr. Yaffe is going to make a comment on that in there. And right now our recommendations from the National Advisory Committee on Immunization, just because one may have had a record of having COVID before, is not a contraindication to getting vaccinated. But I'll let Dr. Yaffe give you some more details on how that interacts with vaccination and how an acute case of COVID versus a recovered case and different aspects there.
Yeah, thank you. I mean, obviously we're still learning, and we will go with the most current evidence as more people get vaccinated and the experience that happens. Current information is that people, of course, can get reinfected. Unfortunately, having had COVID doesn't mean you won't get it again. So the bottom line is, at this point, we're saying even if you've had it before, you should get the vaccine when you are in the group that's eligible for the vaccine and you have no specific contraindications to it. But again, we're monitoring very carefully, and we'll continue to learn. The other thing is there will be people who may have had it and didn't even know they had it. So certainly near the beginning where people weren't necessarily getting tested. So at this point, we're not going to differentiate people who've had it or didn't have it in that respect.
Last question.
From David Woodard at Global News Radio 640 Toronto.
Good afternoon. Thank you. Global News has obtained some of the numbers of patients in Ontario ICU beds over the past 5 years and have noted that the number of people being treated on a similar 10-day span are indeed higher in 2020, but not significantly, as in a difference of about 34 unique patients during the same time in 2016. And logically, this year it would be less of a problem because according to the public data, we actually have more ICU bed spaces available. So my question is, why are we treating this year like ICU space is a bigger deal? And if the numbers have always been this high, then why hasn't it been addressed before 2020?
Okay, so a number of points in there. I agree that we have added some ICU beds into the mix. Our population's increased as well in that time, and our population's aged in that time. We have more people in the frail category involved in that. So our demands are bigger. The amount of procedures and surgeries has increased as well. So the number of things have changed. So not only one thing changes, a number of things do. It's been interesting to hear interesting but informative, I would say, to hear their experience with COVID patients, and to hear that the specialists say that to care for a COVID patient is 4 times more demanding staff and resources-wise than an influenza patient. So obviously these are more complex cases to manage. They take up more time in the facility. They've worked hard to get the median time down from what it was. It was very long before. And so once they get into there, they stay for a long period, and then unfortunately some do die even with that prolonged period in there, but many do recover. So I think to make some comparisons to the past is a little different. COVID's a new entity, and its demands on the team in the intensivists is different, and we're learning as we go. We've learned a lot from the first wave, and they made some progress. But those cases still come in, and remember, we are now operating as compared to the first wave with the hospital system up and running pretty well as best it can, but now we're going to have to curtail that. In the first wave, we canceled all elective surgery and procedures, and so the hospitals for a large part had a lot more space to move to and to adjust to than we do now, because the hospitals are all at fairly about full capacity, because we're concerned about delaying some things even longer, especially ones around cancer diagnosis and other procedures and that. So it's an interesting comparison, but I think you have to look in the time frames and put all the variables on the table and ask the specialists and the hospital people to enter that discussion.
Follow up, and this is the last question.
Thank you. And this question is from my colleague, Shalima Maharaj. The education minister told us yesterday that every step of the way through the pandemic, they've followed your advice, and that has given them the guidance to be able to keep Ontario schools open. So what is your guidance for schools following the winter break, and is there going to be an extension?
So one thing, we have put out our model of a school opening. We've added our public health nurses. We've put all the IPAC in the schools. We're trying to ramp up even more with testing. You've seen some lowering of the symptoms for evoking a test requirement. We continue to look at how do we undertake this in a scenario of high community transmission, how well we've been able to fend that off. We still get lots of cases coming into the school that have been infected in the community. And how do we disrupt that with cohorting and to not close the whole school? So we've been, compared to the overall picture, been quite successful, whereas when we started off in this in September, the general commentary would be lucky if we stayed open until Thanksgiving. And now we're completing a semester. It was not without a lot of work, without a lot of challenges, and we see that elementary is different than secondary. We've seen the transmission among our older secondary students much more mirrors adult population in their with the case per 100,000. So we've learned that as well, I should say. And so the recommendations, we are using our committees to look at the changing situation with schools, because the schools are doing their thing, but the community is changing. Our rates per 100,000 are going up, and different parts of the community within health units have more higher rates than others. And how do we handle that? So I think we can have schools open. We've done it before. We can have them opening safely. I just would be leery to have them open up in the midst of a maelstrom of a rapid sweep up in cases in the community. And that's what Dr. Brown was concerned about, just because they do reflect what's happening in the community is impacting on the walls of the school, if you may, that metaphor. And we know opening the schools has been a valuable thing. We've heard huge amount of testimonials about the psychological benefits to the children, and the specialists have weighed in on that. And so we'll continue to address that situation, because in the end we do want the schools, especially elementary schools, open to the in-class attendance because of the benefits of that have been, I guess, professed by the specialists in those areas. And so we will continue to work with the Minister of Education and with our MOHs, with the schools, to try and to make sure that our schools are safe as they have been in the fall.
Thanks, everyone.